What if I told you that one of the largest Medicare premium hikes in history is coming in 2026? For millions of seniors, this could mean paying more than ever for healthcare. How is this happening, and what does it mean for those already struggling on fixed incomes? Stick around to find out the truth behind this major shift. In 2026, Medicare Part B premiums are set to jump by nearly 10%. That's a $17.90 increase, pushing the standard monthly premium to $202.90. Now, this isn't just a small bump, it's one of the largest hikes in the history of the program. For many retirees, this hike will eat into their Social Security cost of living adjustment, which is only $56 a month, so they're essentially getting a double whammy. And it's not just Medicare that's feeling the pressure. Premiums for employer-based insurance and Affordable Care Act plans are climbing as well. Across the board, consumers are facing skyrocketing healthcare costs at a time when everything else, rent, food, utilities, are more expensive than ever. So what's going on? Well, experts say that one of the biggest reasons for this premium surge is the aging population. Baby boomers are entering the Medicare system in droves, and their healthcare needs are contributing to rising costs. Plus, a shift from hospital care to outpatient services is higher spending in Medicare Part B. The shift to outpatient care for complex procedures is adding even more strain to the system. And to make matters worse, Medicare is having to absorb the rising costs of prescription drugs and medical inflation. Medicare Part D, the prescription drug component, will also see fewer adjustments, but it's still facing premium hikes of up to $50 in some cases. Insurers are reducing or maintaining their plans, and the number of options for Medicare Part D plans is declining, meaning fewer choices for beneficiaries. The situation is even worse for Medicare Advantage, which now covers more than half of all Medicare beneficiaries. For the second year in a row, plans are shrinking, with major insurers pulling out of the market or reducing coverage. Over 2 million enrollees will lose access to their current plans, and in some areas, like parts of Vermont, there won't be any Medicare Advantage options at all. So what does this all mean for seniors? Rising premiums, shrinking benefits, and fewer options are creating a perfect storm of financial stress for older Americans. And with out-of-pocket medical expenses also increasing by around 10%, it's clear that many seniors will be under more pressure than ever to make ends meet. So what's the takeaway here? If you're a senior or you know someone who is, the reality is that Medicare costs are about to go up, and it's going to get harder to afford the healthcare we rely on. With fewer options and rising out-of-pocket costs, the financial strain could hit many of our most vulnerable citizens hard. But don't worry, we'll continue to keep you updated on this issue and what you can do to navigate the changes. If you found this video helpful, hit that like button and subscribe to the channel for more updates on Medicare and senior healthcare. And if you or someone you know is affected by this increase, leave a comment below and let's talk about it. Thanks for listening, and we'll see you in the next video.